Hello, welcome to Grade.com Talks With. Today we're talking with Jennifer Hyman, Director of Communications at Living Goods, an organization that saves life at scale by supporting digitally empowered community health workers who deliver care on call, making it easy for families in need to get the care they need. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app, because today we're going to learn about an organization that has served over 8 million people in 2020 alone. Hello, Jennifer. Welcome to Grade.com Talks With. We're excited to have you here.
Thank you so much. It's really a pleasure to be on your program.
Wonderful. How would you describe your organization to someone who is not familiar with your work?
So we try and help networks of government community health workers to actually ensure impact. You know, throughout the world, most people, when they're sick, would ideally go to a doctor or to a nurse. But in reality, most of us don't have fair, equitable access to medical services. You know, the World Health Organization recommends that there's one doctor for every 1,000 people. But if you look at a country like Uganda, there's only one doctor for every 25,000 people. In many countries around the world, that disparity is huge. And for the health services that exist, they're strained. So they have queues of people who are waiting long lines to actually be seen. Sometimes when somebody gets to a facility, the medication isn't available. So what community health workers do around the world is people like you and me get basic training to be able to deal with some of the most deadly but easily treatable illnesses. And by doing that at their doorstep, you're increasing access and you're really helping to ensure that facilities can deal with the most urgent care. Now, specifically for my organization, we didn't invent community health workers. They've been around in many countries for a long time, but often they get trained once, they work via paper, and they don't necessarily even have medications to treat. What they're doing is assessing and referring to a clinic to figure out who needs care. We focus on 4 particular elements in particular that we think of as the acronym of DESK, but we digitally empower them. We put a smartphone in the hands of every community health worker to give standard quality of care and to give data to government and to other supervisors. We equip them with medicine. We supervise them and ensure performance management so that people actually are trained and retrained, and we ensure they're compensated so that they're actually motivated and rewarded and not just working as volunteers. And we do that both through networks we manage, and we work increasingly with government, directly to support government to begin doing these 4 aspects to ensure that they're strengthening the health system overall to ensure everybody has access to care.
Wow. So I personally, if I was someone who's looking for medical treatment, whatever I do, the first step I do is like I try to search the symptoms and everything on Google, and then I get scared. And if I had a community health worker, I can just directly ask them, and then they could forward me to a resource or to a clinic or to a doctor that would be the most of help. So you are an alliance of those community health workers, correct?
Yeah, well, I'd say that we are working to support and strengthen the effectiveness of these community health workers to ensure that they can be effective and that they can actually save lives. And by doing these things, by digitally equipping them so that they can actually check your symptoms, have a thermometer, have treatment at their disposal. If they, let's say, somebody presents with symptoms like malaria, they're coughing, they're feverish, you can run a malaria test right there in someone's backyard. Say, oh, you're positive for malaria. I'm going to treat you now with malaria. My digital app is going to tell me to follow up with you in 48 hours and then again in 1 week. And if your symptoms worsen, I'm going to refer you to the health facility. Or, gee, nothing in my app, I can't figure out what's happening. You've tested negative for malaria. You don't seem to have pneumonia. You're really sick. You have a temperature. I'm going to make sure that you have a referral, that you get to the front of the line at the facility because you're urgent. So it's things like that, helping to really, our particular organization supports children under 5 and women and women of reproductive age who either are mothers or would be mothers. So there are community health workers around the world who deal with adult issues. But for, if let's say you presented to one of the community health workers we support, they might say, gee, we'll give you a referral right now to the health facility because we're focusing on children and mothers. But we're really focused on the greatest mortality rates, which are, in that first 1,000 days of life, right after a mother has given birth, making sure children get immunized. These are the kinds of things when it comes to a health system and overall well-being that basically trained people like you and me without medical degrees can safely deal with. We don't want to, I wouldn't be, if we had basic training, we wouldn't be able to deal with more complicated issues necessarily. You'd want a doctor if you have cancer or something like that, but community health worker can deal with things like malaria, diarrhea, pneumonia, family planning, immunization, that kind of stuff.
I understand. So the fact that you chose a niche of helping children under 5 and then women in infertility age, so you can focus more on the specific target audience and issues, helps you to navigate more in detail and more correctly. And one of the questions I had about community health workers, you mentioned that they have the basic training of issues that they're working with, but how do you choose someone to be a community health worker? Do they become voluntarily community health workers? Do they get paid, or how the system works with community health workers?
Yeah, that's a great question. It's different in every country. And so, but typically, most countries and the countries we work in, there are government community health workers. So we are not creating a parallel system. We're not looking to create a separate system. We're going with the existing government community health workers whenever possible. And oftentimes those people are recommended by their own community. They're nominated. They're people who are trusted by the community. In certain communities, like in Uganda, there are fewer community health workers. They're known as village health teams in Uganda. We don't have as many as there are in Kenya, for example. So in cases where there aren't enough to serve a community, we may go out and hire, my cat is paying a visit, we might go ahead and hire community health workers who are recommended by community leaders, by elders in the community, but ultimately, once we train them, they do become government community health workers. They become part of the government pool if they weren't originally. So our goal is never to duplicate and to create a parallel system. We're ultimately seeking to build sustainable government health systems, and to really serve as a supplement to government to really help them lead. Our goal is never to independently lead and for Living Goods to rule the world of community health workers. We want governments to lead. We want sustainable health systems. We're just here to provide some technical assistance to ensure that they really can save the most lives as possible.
Mm-hmm. I can recall my own experience. I grew up in Tajikistan in a small town, so the amount of hospitals available there was very limited. And you mentioned that community health workers are often the people who have a reputation, who are trusted people. So in my community itself, there was a person who, whenever someone was sick, we would call and ask them for advice. However, they didn't have basic training, and it was more of a traditional health in terms of following the traditions, ordinary things. So having someone who has basic training of the improved medical care that we have today is much more important, and it's much more beneficial. You mentioned that you work in Uganda and in Kenya. What are some of the most challenging health issues that the community health workers that you support are helping the people that they need care of?
Yeah, so we primarily focus on diarrhea, malaria, pneumonia, family planning services. So we offer a range of family planning services from, condoms and birth control pills to injectable 3-month contraceptives that,
Mhm.
can last, and injectables are most preferred by women in Africa. We also focus on immunization care. So those essential immunizations, community health workers are generally not allowed to give vaccines, but they are allowed to. What we do is we use the technology to know the real-time immunization status of every child with GIS location, and to follow up for each vaccine and make sure that they get to the facility and to continue following up until they're fully vaccinated. And you can imagine in a time like COVID, I think it's worth bringing up this moment
Mhm.
because we were aware when COVID hit that looking back at Ebola, more people died of measles and of malaria than Ebola itself. You
Mhm.
have a moment like this, and a health system that's already constrained becomes even more constrained. And people have fear of getting to a facility. They have actual challenges getting to a facility because of lockdowns and movement restrictions. And so having a trusted neighbor that also now has digital technology that enables them to remotely serve people with some distance. They're wearing PPE because we also equip them with PPE. So to be able to continue delivering services in a moment of COVID, when we saw, you read our year-end report, we saw that fewer people were visiting facilities.
Mhm.
And at the same time, instead they were turning to care from their neighbors. And that's how we were able to save double the lives of last year, because doubling down and providing ways in a moment of crisis. This is when community health care is even more important, because it's about ensuring that functionality of a health system so that, more people don't die of malaria. Malaria burden is huge in many of the communities that we work. It is diarrhea. I mean, these things seem like ordinary. We all occasionally get diarrhea. Like, why would that kill you? But the number of children who die from really preventable illnesses, mothers postpartum, that first 48 hours, having somebody to make sure that they check in on her, to make sure she delivers in a facility, to make sure that after she's delivered, she's okay, to make sure that her newborn is breathing well, like having somebody there who can get you to a facility in that God forbid moment, if you're living in a rural area, is huge. It's huge. There's no ambulance to come. Like, who's going to make sure that you get on a motorcycle if you have to get to the clinic? So it's that kind of stuff that seems ordinary. I live in Washington, D.C., and God forbid I could get in my car, call an ambulance. But if you're in a rural area, who's going to actually help you in that moment of crisis and anticipate when you're not anticipating that, oh, I've just given birth, those next 48 hours might be super dangerous. And to have someone show up at your doorstep to check in, that's huge, and it saves lives.
Unfortunately, the statistics of the simplest diseases are very disappointing, are very sad, especially in those remote areas. Living in the developed world and developing world, we often don't realize how communities living in an underdeveloped world face challenges, and those challenges may be simple for us, but in reality, those are live and die moments for so many people around the world. You mentioned that you digitally support community health workers, and you also, during the COVID times, you provided them with equipment and clothing that is necessary. How does the digital support work? Can you, because it's something different, and we're all often used to, you mentioned that in previously it was paper, but now with technology evolving, how are you helping those community health workers?
Yeah, sure. So we originally started with just basic flip phones and SMS messages, but in 2015, we partnered with an organization called Medic Mobile to develop a community health toolkit, a open source technology that is free to anyone, but we help to customize this and to develop, it's called Smart Health, but it's an app. And we provide every community health worker we work with this technology. Now, the technology has what we call workflows. And the workflows are basically the intake mechanisms. So, there are a number of targets and key performance indicators that every community health worker has. So, she wants to make sure that she's registered every pregnant mother in her community and every under 5 child, that who you're supporting. So imagine that a community health worker is supporting 100 households and anybody who's eligible. So she has a regular roster of people that she will visit just because she'll just swing by once a month. How are you doing? And check in. But that person is available on call. So I have a problem. She has signs in front of her house and gives out her number. So anytime there's a problem, it's like calling for an Uber. You say, hey, I've got a problem, I need support. And sometimes we've even developed some technology for SMS help as well, but you can request that support. Now she can come with her digital phone and work through a workflow to find out whether it's, I'm pregnant, I'm already pregnant and I'm having an issue, or my child has a fever. She's going to ask very specific questions that are already in her phone. It takes the guesswork out of it. There's no, there's different quality of different people. But if you're just going through an algorithm that's telling you what to do, okay, now take the child's temperature. Okay, lift the child's shirt to make sure you can count their breaths for pneumonia. There are protocols that the app walks her through to make sure that she is delivering a consistent quality of care. And everything is digitized. Now, what's so great about that is not only does that provide her with what we'd call, task lists. So, the next day, it's going to remind her to check up on that sick child. It takes the guesswork out. But then we have supervisors. So the supervisors, whether they're living good supervisors or government supervisors, they can see in real time what's happening. They can manage that workforce. They can see who's a rock star and is exceeding their performance indicators and who's lagging. They can also spot disease outbreaks. Gee, this community, look at the number of kids who are coming up with malaria right now. And at a national level, I mentioned we're increasingly using that data to drive national trends. It helps governments to effectively budget for and operationalize their own health system. Because what's been happening is, for so long, this community health work has been taking place, but governments aren't even getting the data. If nothing is digitized, then they don't know what's happening. They can't include it in their national plans. They can't prioritize it. So by giving that data visibility and training governments to take on these kind of digital approaches, it really transforms the health system. And we're actually seeing that happen in Kenya right now, where the government is like taking on a national plan to digitize its community health system, and we're supporting in that, which is super, super exciting.
So I see two support systems that you have provided. One for community health workers and providing them with toolkits, digital toolkits, so it's easy for them to have the first stages of diagnosis. And then at the national level, you have provided a database that can provide government with numbers that they can take action on and take steps when it's starting, rather than post factum. So you're providing necessary information pre factum, so less and less people can get affected and more people can get support. That's wonderful. How do you see the work of community health workers changing in the upcoming 10 to 15 years in the countries that you work within?
Yeah. So, there has been a growing movement for universal health coverage. Mm-hmm. And that is something that resonates whatever country you're in, that it's a human right. Everybody should have access to basic healthcare. No one should die for lack of access to, something that's easily preventable and treatable. It's just a human right. And increasingly, it was actually in Almaty, in Kazakhstan in 1970, the UHC declaration first came into being. And it was at that point at this that there was a understanding that not only was this a human right, but that community health was an essential vehicle for universal health coverage. So this movement for universal health coverage has been growing, and increasingly governments are recognizing it. They are putting it into their policies. What we want to see in the next 10, 15 years is that they are officially part of health systems, that governments take the responsibility of financing them, of equipping them, of ensuring that they have the medicine that they need, of ensuring that they're supervised and compensating them. Because, like in Kenya, they're called community health volunteers. Well, volunteering, like that is not very rewarding over time. It is part-time work. Very few people do it full time, but it's very time consuming. It's arduous, going through the mud and rainy season. Like, it's tough work. And most people don't do it for the money. They do it because they care about their communities. They want to serve and to support, but they need to be compensated in some way. So we're working more at that influence level increasingly with government, because we want, that's the vision, is that no one dies from an easily preventable disease. That even in the United States, that community health workers are valued and supported, because we saw here, even in, one of the most developed countries in the world, we were hit by COVID. We have been devastated by disease here. There are poor communities here who don't have access to healthcare or insurance. It's a global phenomenon. And so the more that we want to just see governments ensure healthcare for all and to invest in community health, because we know it's a proven way to save lives at scale.
So community health workers are essential people to get the universal healthcare. So everyone has access to healthcare and everyone can get treated easily and as soon as possible. That's very, we undermine the work of community health workers, but in reality, they are doing major work and helping so many people across multiple communities with different backgrounds. So that's incredible. For someone who would like to support your organization, how can they do that?
Well, we have social media channels. We encourage you to follow us, and on our website, we obviously welcome financial support. There is a donate button on our website. But even more importantly, advocate for community health in your community. I mean, what we really want to see is grassroots mobilization of people lobbying their own governments, of pushing for effective quality of care for all, to support for community health workers in your own communities. And that awareness is critical. We are constantly pushing out information about community health workers. This happens to be the year of the care and health worker. This is an amazing moment for advocacy. So while we obviously welcome financial support, we would be thrilled to have that. More than that, we welcome awareness and support and mobilizing in your own communities to demand that, equal access to healthcare, and effectively supporting community health workers to bridge that gap, because they are the glue in the health system, that when things start to fall apart, that that things don't completely evaporate, that you have some sustainability in the health system.
Well, after our today's conversation, I will be one of the first people to advocate for community health workers and for universal healthcare, because of our conversation and the awareness that you spread through our conversation. And I'm sure our listeners will appreciate that and will take action as well. It was wonderful to have you here and learn more about Living Goods. Thank you so much. Have a wonderful day.
Thank you so much. It was a pleasure chatting with you. Take care.
And if you liked our conversation, please press like and share button either on YouTube or your podcast app, because this will show YouTube algorithm and the podcast algorithm that this is an important conversation, that community health workers need more support. Thank you, and see you on the next episode.